Welcome back. We're here with Pat Sullivan talking about how to keep eyes looking young and beautiful. So, Pat, several women had some questions for us. So let's take a look at the first one.
Okay.
So what's the difference between fillers and Botox?
That's a great question.
That really
Patrick,
is.
you know, people have heard about Botox and fillers, but specifically, can you address, you know, maybe generally what is the difference between those two, but how do you use them differently around the eye?
Well, I think Botox is a particularly good agent to think about muscles. So all of these creases tend to have their derivation with muscles, and so if we can put Botox in this region and get the muscles not to be so active, that really helps much more than fillers do.
So it's like crow's feet. Is that when people talk about crow's feet?
Exactly.
Yeah. Does it hurt?
Well, the Botox we usually do in a way that patients find not to be uncomfortable, because we numb up the area first with a topical agent, and then we also put some cooling on it, and so they say that it's not an uncomfortable thing.
Now, you've done a lot of really excellent research on fillers around the eye. Can you tell us a little bit more about that?
Well, the filler that I like to use the most is the person's own fat. You know, if we use their own fat and it comes with their live cells and stem cells and we bring it up into that area, that seems to work the best. But I really like it when I can take the fat that's already there and bring it down into the place that I need it and do it from the inside, so I don't have to have any external incisions. So that's my favorite filler, is fat.
And you use fat in the upper and lower eyelid, is that correct?
I do, yes. I will use fat to fill in those people that have that deep sulcus in the upper eyelid. They say, I've got these hollowed out eyes. I look like my grandma in a nursing home, and they come to me, and even when they're young. So we will fill in the upper eyelid with fat that we take from them. We also will do fat grafting in the lower lid, but again, I really love it when I can use the fat just that's already has its blood supply and bring it down over the edge and suture perfectly in position where we need the fat to help get rid of those circles.
To try to really kind of reposition it so they're not as hollow looking.
Yes, yeah. Well, to reposition it, because of those circles can just make somebody look old or tired or sad.
And I think we'll actually have you specifically address some dark circle questions later. I think we have a question on that. So let's look at the next question.
Okay.
I know that an eyelid lift can help you look younger, but when is too soon?
Well, I think that too soon is when it can start to have somebody look abnormal. You know, what my specialty is trying to have people look very natural after their surgery. So people will say, you look great. Did you go on vacation? There's something different about you. Did you change your hair? Rather than, whoa, what did you have done? Something like that. So I think that it very much depends on the surgeon that's doing it. And you want to make sure that you get a board-certified plastic surgeon who's incredibly well qualified in the eyelid region.
I think that's an incredibly important point. You brought a really interesting picture that I'd like you to speak to. Just, again, it gets back to individualizing the care of the eyelid patient, but there's some patients that they may have their deformity, so to speak, or their eyelid condition has been since they were a very young baby.
That's correct. Yes, and so those are people who oftentimes have inherited that kind of a problem. And people with puffiness and circles oftentimes say, this is just like my mom, or just like my dad, or I've got my sisters have the same thing, or brothers, and a lot of men have this kind of surgery too. So we try to fix exactly what the anatomic problem is and get rid of those circles by finding out in surgery where the problems are and then filling them appropriately.
What about incisions? Are there incisions around the eye or in the eye? Where do you put the incisions?
Well, that's a very good point, because there are external incisions that cut through the skin, cut through the muscle, and then go into where the fat is and either take it out or reposition it. I like to avoid those as much as I can. I don't want to have any scars externally unless I absolutely have to. So a great percentage of my patients have incisions that are made on the inside. If we can protect the eye, bring out the lower eyelid, and make an incision on the inside that makes that external incision unnecessary. And that's been spectacular.
And the external incisions for the eyelid are pretty well hidden. Is that an incision, once it's healed, that you can see, or does it blend in?
Well, the The times when I will use an external incision is if somebody has a lot of extra skin there and I want to pinch out a little bit of that skin. So I bring it up right underneath the eyelashes. And I have some examples of that, of people who have had it pinched out, and that can be very nicely hidden. But what I want to do is I want to avoid going through that muscle that helps close the eye, because I don't want to have the eyelid brought down or any type of lower lid position that isn't exactly right. I want it to have it perfect after surgery.
Going to somebody like yourself that has a specific expertise in eyelids is important, and you mentioned it. Going to a board-certified plastic surgeon is really imperative.
I think it
because you can have some bad complications.
Well, as you know, Bill, there are so many people now who are trying to get into plastic surgery, into doing plastic surgery, and they advertise it, and people go to them and they don't know. And so you want to find somebody who you can ask, show me pictures of people that you've done, that you've taken care of, and how it looks.
That's great information. Well, let's look at the last question from the boutique.
Okay.
What can I do about the dark circles under my eyes?
That's a tough one, huh, Patrick?
That is a tough one. So I say makeup is the best thing, but that's not the only thing. If the dark circles are from the shadowing that we have with overhead lighting from the puffiness, then we can certainly help with that by bringing that fullness down in to fill in where the circles are. But that dark circle, that's a problem. And so I have a makeup artist in my office, I have an esthetician, I have people who are real experts at this, that they can help the patient not only with surgical, but with non-surgical things too. And there's so many things that we can do without surgery.
I mean, your patients come to you from all over the world. Is that typical, that people are going to fly across the continent to see you for eyelid surgery?
Well, I think now with the internet being as powerful as it is, people get to find out what expertise is out there, and it's their eyes. It's their face, it's their neck. They can't hide it. And as you said earlier, people look at your eyes, you communicate with them, and so people are willing to travel for this kind of surgery. And I think it makes a lot of sense because there are certain individuals out there who have done research and have really tried to make contributions in particular areas. And I try to always get the people who come to me in the hands of the very best person.
That's great. So Pat, before we cut you loose, I wanted to see if you'd be willing to answer one of our questions that comes via Twitter or email.
That'd be a pleasure.
Okay, well, we're going to do that right after the commercial break. We'll be right back.
Did you know that breast implants can explode in an airplane?
Really? I didn't know that.
You know, you can donate the excess skin from your tummy tuck to the Shriners.
I can?
My doctor said Botox would get rid of your acne.
Oh, that's fantastic.
The Myth Files, dissecting truth from fiction in plastic surgery.